Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Winning.
I'm Dr. Paul Zalzal.
On today's episode, Paul, we're talking about something that's very personal for both of us.
Yes.
And for lots of other medical trainees and doctors out there, the top 10 worst things you've ever heard that were said or done to a medical trainee.
I don't want to relive this.
It is a little bit
I don't want to do this
dramatic.
topic.
And I think a lot of people recognize that medical training is hard, but the shows mostly glorify them. And there's a lot of times when you do not feel very good about yourself.
It took a long time to get over these.
And you question whether or not you made the right choice because you're an adult and you're getting treated sometimes not like an adult.
And you're making me bring these up again.
Yeah, so sorry to your therapist. I'll apologize in advance. It's going to take a little bit of extra work this week. Okay, number one.
Number one, when the surgeon turns to you as you're learning in the operating room and says, I wish there was two of me and none of you.
That is not a nice thing to say.
It hurts.
It's not a nice, I like that one though. So number two is, I specifically heard this during our training. There was one of our staff guys who said this to multiple residents, if not every resident, during the operation. Other than scrubbing out, is there anything that you can do to help this case? Doesn't make you feel very good about
No,
yourself.
scrubbing out means to leave the OR, by the
So
way.
get out. That's what's going to help you.
Other than getting out, is there anything you can do to help this case?
Not good.
That's not nice.
Okay.
The next one, I think we're on number three here.
Yeah.
I've heard a surgeon say to the poor trainee, say, you look like you're struggling during this part of the operation. There are some hard parts to this operation. This is not one of them.
Not one of them. You should be better. Just be better.
That one hurts.
That stings. Number four was very specifically me. In first year residency, we were trying to fix a very broken forearm bone. I was trying to measure how long the screw is, but it was in so many pieces it didn't work. And so I said, I can't get it. And without looking up, my staff surgeon said, that's because you're doing it so badly. And this is a room of other people who you have to look in the face later on. Mm-hmm. And then he tried it and he couldn't get it, and I was redeemed.
I was in a similar situation where I was trying to reduce a fracture, so put the bones back. It was a larger bone, the femur, which takes quite a bit of force.
Sure.
And so as I was trying to get these bones back, I just couldn't do it. I was pushing as hard as I could.
Everything you had.
Everything. That's when the staff man looked at me and said, Paul, do you work out like with weights? The sad part at the time was, yes, I was working out with weights, obviously not heavy enough.
Right. Maybe pick up the 8-pound dumbbell.
Do you work out
with weights?
With weights.
That one stings. Mm-hmm. Okay, the next one is often before surgery you'll draw on the patient to diagram not only the anatomy but plan your incision.
Yeah.
And there's one of our staff guys who used to cross his arms to Amelia and go, never seen it drawn that way before. And you're like, really?
Well, that means you drew it wrong.
That means you drew it wrong, and it's permanent marker, so you can't get it off. And
as long as you don't sign it.
That's right. That hurt.
Okay, what number are we on, anyways?
We're on number 7, I believe.
Feels like an infinite list.
Yes,
of things,
there's plenty.
harsh things that were said during training. I remember once I was in the OR, and this was a senior staff member.
Okay.
So 20 years ago, and it was a senior staff member. Everyone was afraid of him.
Yes.
And so he was operating, and I was assisting. And for some reason, the nurse had decided to play music in the room, loud music, which was a little bit distracting.
Yep.
But I was scrubbed in, and he was working. And the only thing I could do to try and help was to adjust the lights.
Yep.
So I was trying to adjust the OR lights, and I couldn't get them just right. But I kept trying because I wanted to get it right.
Sure, because that's all you want to do. You want to help.
Yeah, I just want to help.
Just want to help.
He throws his instruments down, turns and looks at me and says, Zalzal, it's like operating in a doggone discotheque in here.
I suspect the language was a hint more colorful than doggone.
No, he did not say doggone. I did a little bit of artistic editing there.
Yeah.
But that made me feel bad.
Sure, you feel badly about that. And I would say similarly, because often you're just trying to do it. You have the suction, you're trying to retract, you're trying to adjust the lights. And I had a trainer, one of my staff men say, Brad, to assist is to help.
You would think.
And then you just want to say, but I was trying to help.
That's what I was trying to do. Sorry that didn't come across.
I was trying to help.
I remember one night we were operating all night on a variety of fractures.
Sure.
And then in between cases, my staff guy lied down on a bed outside the OR and said, my neck is really tight.
I don't like where this is going because you told me this story before.
And then I said, oh, that's unfortunate. He said, do you think you could just give me a little massage?
So weird.
20 years ago, I didn't know it was wrong.
You just do it.
I just did it. Massaged him. At which point he said, harder, harder. Use your elbows. Basically, I had to jump onto the bed that he was lying on and give him a full body, full tilt massage.
So weird.
I don't feel good about it.
Ah, okay. And then the last one is I suspect common, where staff surgeons or trainers imply to you that you're not at the level of training that you should be in, and they say, "Oh, are you the new med student?" You're like, "No, I'm like a senior year resident. I'm like about to graduate and be on my own." They're like, "Oh, I thought you were the student."
Yeah.
And you're
that one hurts.
that one stings.
That just erased the last 5 years of hard work you did.
There's a lot of crying in residency. Yeah, a lot of crying. So if you like this video, please like it, subscribe to our channel, and be nice to medical trainees.
If you see your surgeon and you think this guy's a little crusty, or this woman is a little crusty,
Sure.
or this person is a little crusty, now you know some history as to why that person may be that way.
So
Remember, you are in charge of your own health.
we'll see you next time.